The first story we're going to look at is how RPM can solve many patient and provider problems in rural healthcare. This is in Healthcare IT News, and they did an interview of Kimberly O'Loughlin, CEO of Health Recovery Solutions. Here's just some of the things that she pulled out. She said, for example, the Mayo Clinic has shown that 72.5% of remote patient monitoring patients comply with care plan tasks, including taking meds and monitoring vitals. Further, only 9.4% were readmitted within 30 days versus 20% of patients not using RPM, especially in rural healthcare. What are your thoughts from this article and your experience?
I think that this is very close to heart. Again, our solution is pretty much a remote patient monitors. That's where we are positioned. I'm just going to probably talk more about respiratory health because that's where I'm familiar with much more than diabetes, strokes, and cardio for that matter. So I do think that RPM is a good solution that could benefit patients, especially in the rural areas. I would just name probably about three, main benefits that I see in RPM solutions in the market today. I think the first one is the ability to do continuous monitoring of patients. And for us, what we do is we monitor important parameters such as their breath rate, heart rate, but the most important thing is actually the occurrence of wheezing. Because of the ability to do continuous monitoring, it allows us to actually detect potential attacks early. And in that sense, it enables us to notify the patients to take early interventions before the conditions even deteriorates even further. So in that sense, we think that RPM is provided to work towards effective disease management, leading to better health outcomes in patients. The second one is actually more of how we can actually help in terms of achieving cost efficiency and resource allocation. In the event that we are able to help identify health issues early on in patients, we can pretty much reduce the need of patients having to be admitted to the EDs. And this is a significant cost savings as well as burdens on healthcare professionals in the ED setting. One of the things that I would like to share as well is that in the space that we are at in the US, approximately 25% of all ED visits are attributed to asthma and COPD conditions. So again, if you have, and the reason of 25% is because you have cases where people are really severe, they go into the ED, or you can have parents like me, when my child is suffering from asthma, I get very anxious in the middle of the night. I just rush down to the ED because I just want a doctor to look after my child. With the idea of RPM, potentially, we could help to triage patients by really assessing who are the serious ones and who are those that continue to take an inhaler, we observed, and we let you know if you need to go down to the ED. And the idea is really to help to elevate the stress on the ED environment and better allocate resources. And the last one is what we have mentioned and what we are talking about, accessibility. I think that with population living in rural places, this will be a good way for us to monitor this group of patients rather than having them to travel 1 or 2 hours just to go to the closest hospitals or clinics to seek care.